Hello there, CBT Compounding Pharmacy today, presenting our portion of our business plan to you, introducing Ms. Katie Matthews, Ms. Taylor Schaffner, and Mr. Brandon Perticone. So, CBT Compounding Pharmacy, the new compounding landscape. CBT Compounding Pharmacy will soon be the newest addition to the University of Colorado Anschutz Medical Campus and will serve as one of the nation's premier academic teaching institutions in the field of compounding pharmacy. Our pharmacy will pave the way for innovation and technology within the industry while adhering to the utmost levels of safety and compliance in order to provide superior service and care to our patients. CBT Compounding Pharmacy will include both non-sterile and Category 2 sterile practices, each of which will be used for hazardous and non-hazardous drug compounding.
So there are several legislative bodies that we will have to be familiar with and compliant with here at CBT Pharmacy. The first of which is the United States Pharmacopoeia, or USP, which is a non-government organization that establishes compounding and manufacturing standards. These standards are then utilized by both the FDA and the State Board of Pharmacy to create their legislation. Chapters below 100 or 1,000 are considered enforceable. Both chapters 797, which deals with sterile preparation, and chapter 800, which is the hazardous drugs and their handling in healthcare settings, will be important for us to be compliant with here at our pharmacy. It's important to note that the chapter 800 is not going to be officially implemented until 2018, which gives us adequate amount of time to build and make our pharmacy compliant with these new regulations. Additionally, there are several FDA guidance documents which are listed here. Perhaps two of the most important ones are the Federal Food, Drug, and Cosmetic Act, as well as the Compounding Quality Act. Both of these are regularly updated, and guidance is posted on the FDA website for pharmacies to look at to help guide the interpretation of these laws. Additionally, there are several others listed here which will also be followed. In addition, there is the Drug Quality and Security Act within the Food, Drug, and Cosmetic Act. This is going to allow our pharmacy to be registered as an outsourcing facility, which will further expand our practice while still being compliant with good manufacturing processes. Within this is Title II, the drug supply chain. This requires that the drug be tracked and monitored from its manufacturer all the way to the patient. We plan to utilize the most up-to-date technology to remain compliant with these new policies. Perhaps the most important is the Colorado State Board of Pharmacy. We will be working most closely with this board to follow all of their laws, rules, regulations, and policies, which are listed here. The Title 12 and Title 18 are two of the laws in which are going to be most important for implementing in our pharmacy. In addition, more information on all of these can be found in the Department of Regulatory Agencies website.
So, in order to be compliant with the aforementioned policies, we will be using in our sterile lab horizontal laminar airflow workbenches for our non-hazardous preparations, and a vertical airflow workbench, as well as the compounding aseptic containment isolator for our hazardous products. In the non-sterile lab, we will be using Class 1 biological safety cabinets for both non-hazardous and hazardous preparations. Our sterile hoods will create a work environment that meets or exceeds an air quality of ISO Class 5 to ensure sterility. All of our hoods will be equipped with a HEPA filter to remove greater than 99.99% particles larger than 0.3 microns in size, and all of our hoods will function continuously. The environment in which compounding will take place will include an anteroom of ISO Class 7, buffer area of ISO Class 7 or better, positive pressure room for non-hazardous sterile preparations, and a negative pressure room for hazardous sterile preparations. There will be 30 air exchanges per hour and a controlled temperature of 20 degrees Celsius in the sterile lab. In our non-sterile lab, we will ensure there are no porous surfaces, and humidity, temperature, and ventilation are all maintained in accordance with USP Chapter 795. With regards to certification, our hoods shall be recertified and calibrated every 5 years and serviced, 5 years or when serviced and returned to the work area. Air pressure documented daily by our staff, and air quality testing will be performed every 6 months by a certified inspector.
An important aspect of our business plan includes environmental maintenance. Some of the agencies and regulations are listed here and include the USB and FDA. Our goal is to monitor and document to assure environmental and personnel controls are in place to prevent contamination and ensure safety. Environmental monitoring will occur with the following plan: a quality assurance program designed by our pharmacy, certification, training, routine recertification, and constant data collection of the following parameters. This is a chart from the USP. It includes some of the parameters we'll be monitoring. We will develop a contingency plan to evaluate work practices and procedures based on this data collection. Another important aspect is quality assurance. Our goal is to provide insight for monitoring, evaluating, correcting, and improving our compounding processes. Key elements include personnel, USP grade products and certification, equipment, environmental monitoring, product stability, and quality measures. Our contingency plan requires documentation, corrective action, follow-up, and new technologies as needed. Risk management is the final part of our plan. The goal is to manage a wide spectrum of risks that could affect the patient, personnel, and livelihood of CBT compounding pharmacy. Key aspects include medication errors, quality-related events, environmental risks, financial risks, insurance coverage, and personal liability. Our plan is designed because human errors are inevitable. We must handle these errors promptly in a professional and ethical manner. It'll include all team members, especially the patient. Thank you for your time and consideration.